The outer layer is called the capsule. It's dark colored area here. Just inside the capsule is the cortex, and just deep to the cortex is the medulla. Capsule, cortex, medulla. Go ahead, reset. Go ahead. They used to have, are you guys a recording? I was going to tell you a joke. Nah, not now.
No, we doing this? No, maybe not.
I'm just waiting for you.
Go ahead, I don't want to.
Okay. All right, capsule, cortex, and the medulla. Then we have structures. These are the renal pyramids. All these renal pyramids. And in between the pyramids are the renal columns. This is a column. This is a column. Here's a column. You can see the blood vessel coming up through it. Pyramids, columns, minor calyx, they merge to form the major calyx. Major calyx is merged to form the renal pelvis. Minor calyx, major calyx, renal pelvis. The hilum, that includes this entire area here, this depression. It includes the renal artery and the renal vein and the pelvis of the ureter. If I was just looking for this area, it would be the pelvis. If I was looking for this area, it would be the hilum. This is a pyramid and portion of the cortex. That's this and this. Here you can see the nephron, which is the functional unit of the kidney. This is the proximal convoluted tubule, and it's descending down towards the medulla. It's called the descending limb. And then you have this hairpin turn called the loop of Henle. Then it ascends up back towards the cortex to become the distal convoluted tubule, and then into the collecting ducts, the papillary ducts, which drain into the minor calyx, major calyx, and renal pelvis. The glomerulus. The glomerulus is a vascular tuft. All these vessels here, you have the large afferent arteriole entering into the glomerulus, and you have the smaller efferent arteriole exiting. Again, this amount of blood that's flowing in is greater than the amount of blood that's flowing out. That increases the pressure inside the glomerulus and favors filtration. The surface of the glomerulus is called the visceral layer, and the inside layer of Bowman's capsule is called the parietal layer. The space between them is called the capsular space. Visceral layer, parietal layer, capsular space, and the proximal convoluted tubule is connected directly to Bowman's capsule. Together, Bowman's capsule and the glomerulus is the renal corpuscle. Now, in between the afferent and efferent arteriole is the distal convoluted tubule, where you have the macula densa cells and the juxtaglomerular cells here. This is where renin and erythropoietin is produced. Again, larger diameter afferent, smaller diameter efferent. This model here, which is really a representation of the loops and the glomerulus and some of the vasculature. Now, this blood vessel in red that's going this way is called the arcuate artery. Just to put this in perspective for you, this is the arcuate artery coursing over the pyramid. This is the arcuate artery coursing over the pyramid. This is the interlobular. This is the interlobar. Interlobar, arcuate, interlobular. Now I'm going to go back here so you can see the arcuate, which indicates that this is cortex and this is medulla. Cortex, medulla. Glomerulus, glomerulus, all in the cortex, and then the limbs going down into the medulla. So you have the arcuate artery, becomes the interlobular artery, and that gives rise to these individual afferent arterioles. Look at the diameter. Larger, afferent, smaller, efferent. So the afferent is bringing blood into Bowman's capsule, and inside Bowman's capsule is the glomerulus, which is where filtration takes place. You also have the efferent arteriole that's now going to give rise to the peritubular capillaries. So nutrient absorbed from the proximal convoluted tubule goes directly into the peritubular capillaries. For example, if you have an amino acid or glucose or water inside the afferent arteriole, it's now filtered by the glomerulus. So it travels from the glomerulus into the capsular space into the proximal convoluted tubule. So from Bowman's capsule into the proximal convoluted tubule in orange. Absorption that leaves the filtrate goes into the interstitial space, all this blackened area, and then goes into the capillary. So what was once in the afferent arterial plasma is now in the plasma of the peritubular capillary, leaving behind in the collecting tubules whatever the body doesn't need. So the proximal convoluted tubule now continues on to become the descending limb, and here's a little thin segment here which is responsible for water recovery by osmosis. You have the hairpin turn, which is a loop of Henle, the ascending limb, which leads to the distal convoluted tubule. Notice that the distal convoluted tubule comes right between the afferent and efferent arteriole. Distal convoluted tubule, afferent and efferent arteriole. Then filtrate travels into the distal convoluted tubule and the collecting ducts where you have fine tuning, antidiuretic hormone, calcitriol, aldosterone, adjusting the content of the filtrate, and then the collecting duct traveling down into the papillary duct. The papillary duct here, the papillary duct here, drains into the minor calyx, major calyx, and renal pelvis. Now, here's the green board. Once the urine has been formed, and you can see the pyramids here, it's dripping down through the ureter, and it's entering into the bladder posteriorly. These little slits in here are called the uretal openings, and that's where urine enters into the bladder. The ruffled area here represents rugae, so the bladder can expand and accommodate around 400 milliliters of urine. The relationship between the uretal openings here, and the internal sphincter is called the trigone. This region here is where urine begins to exit by way of the internal sphincter. This is the detrusor muscle. The bottom of it is called the sphincter muscle. And urine travels through the prostatic urethra. Obviously, this is a male, and there is no urogenital diaphragm muscle here, but I'll show it to you on the male model. There's an external sphincter here. All right, I'm going to move on to the reproductive models. Back online?
Yeah.
All right, here we have the scrotum, the testes, the epididymis, and the vas deferens. So spermatogenesis is taking place inside the testes in the seminiferous tubules. During ejaculation, it travels through the vas deferens, makes its way alongside the bladder, and meets up with the seminal vesicle here, which is an accessory structure of the male reproductive system. Secretions from the seminal vesicle join sperm cells inside the seminiferous, or inside the vas deferens. This is the prostate gland from the outside. Now I'm just going to turn it around and show you the ejaculatory duct. This is where seminal vesicle secretions and sperm cell make their way into or inside the prostate gland by way of the ejaculatory duct, which then becomes the prostatic urethra. And then here you can see the urogenital diaphragm. This is the external sphincter muscle. This is the internal sphincter muscle. And as we pass through the ejaculatory prostatic urethra and make our way through the wall of the urogenital diaphragm, this is now called the membranous urethra. As we pass the urogenital diaphragm, it becomes the penile urethra, and sperm exits by way of the external urethral orifice. This is the corona of the penis. This is where the glans penis is located. This is the corpora cavernosum, erectile tissue, and this is the spongiosum, which surrounds the lumen, which is the penile urethra. Female. So the ovaries, obviously symmetrical like the testes, but you have an ovary here, and you have a fallopian tube. You have the outer layer of the uterus, which is called the perimetrium. You have the thick muscular part, which is called the myometrium, and you have the inner layer, which is called the endometrium. Now, supporting the ovary, the uterus, you have the round ligament. Here's the round ligament here, and you can better see it in here, coming to the anterior abdominal wall. This is supporting the large pear-top shape of the uterus to the anterior wall. And then back here, this ridge right here, this ridge is a ligament. And this is the uterosacral ligament stabilizing the cervical area of the uterus to the sacral area of the body. Round ligament, anterior wall. Uterosacral ligament to the posterior wall.
Could you tip it up and show us the round ligament too?
Round ligament. All right. Then we have the, again, perimetrium, myometrium, endometrium. This is the uterine cavity. This is the cervical canal. Internal os, external os, that's the opening. And then you have the vagina. You have the urogenital diaphragm muscle. That's the external sphincter. At the base of the bladder, you have the internal sphincter. You have the vestibule, labia minor, and labia major. I got to go back to the male for a second because there's something I forgot to tell you. In the urogenital diaphragm muscle wall is where you have the Cowper's gland. This is the Cowper's gland or bulbourethral gland. This is the prostate gland. Prostate gland, seminal vesicle. Those are the three accessory structures of the male reproductive system. Then we have the menstrual cycle. All right, obviously all of these are uteruses and fallopian tubes at different stages of the menstrual cycle, so it doesn't matter which one I use. But in any case, starting with the ovary, here you have the ovary, and it's suspended by the ovarian ligament here, and out here is the suspensory ligament. Suspensory ligament, ovarian ligament. The broad ligament here is 12, and the mesothelium is 11 above the ovarian ligament and the top of the ovary. You have the perimetrium, myometrium, endometrium. You have the cervical os and the vagina. During the 28-day cycle, the first half of it, you have follicular development. So these little eggs here are called the primordial follicles. They are stimulated by follicle-stimulating hormone, and you can begin to see the granulosa cells around this one here, these little nuclei. That's a primary follicle. As it becomes larger, it becomes a secondary follicle. At its largest, it's the tertiary or mature Graafian follicle. Day 14, the LH surge from the anterior pituitary gland causes the follicle to rupture. So here's ovulation. The oocyte travels into the fallopian tube by way of these finger-like projections, which are called fimbriae. It travels up to this funnel-type area, which is called the infundibulum. You have a slight expansion here, which is called the ampulla. And then you have the fallopian tube, which terminates as the isthmus as it connects to the body of the uterus. After ovulation, the follicle becomes a gland. This is the corpus luteum, obviously still inside the ovary, begins to produce progesterone. Progesterone stimulates vascular development inside the endometrium. There's two layers. There's the stratum functionalis, which is stimulated by the presence of progesterone, and the stratum basalic, which is always present. At the drop of progesterone, when the corpus luteum becomes the corpus albicans, the level of progesterone drops and the menstrual cycle begins. Got it?
What's the joke?
Oh, the joke.